We're going to look at the anatomy associated with the stomach and spleen channel in the lower extremities. Let's start with the quadricep region. So quadriceps are four muscle groups. We have the vastus medialis on the inside, vastus lateralis on the outside, and vastus intermedius in the middle. Those are three of them, and they kind of form a structure very much like this sheet that collectively comes down and attaches below the knee to the tibial tuberosity surrounding the patella. The lateral quadriceps, the vastus lateralis, has a mound that sort of tapers. Vastus medialis on the medial side forms a mound that tapers. And the intermedius is almost like an indented space in between those. So it's a very folded type structure that the vastus lateralis, vastus medialis both seamlessly blend into the vastus intermedius, and the vastus intermedius sits really close to the femur, to the bone of the thigh. And like I said, it creates a little hollow, a little indentation. What fills that hollow would be the rectus femoris, which is the more superficial of the quadricep group. So it's also going to go down, attached to the tibial tuberosity, and it's going to fill that midline. So what we have is vastus lateralis on the outside, medialis, those kind of create a little bit of a bulge. They taper right at that line where the rectus femoris falls off on the lateral side and falls off on the medial side. And this is where we're going to find the stomach channel on the outside and the spleen channel on the inside. It's going to be that seam where the more superficial rectus femoris ends and where the vastus medialis and vastus lateralis meet that seam and blend in with the vastus intermedius. So we're going to be working into that little groove, into that fascial space on the lateral side for the stomach channel and on the medial side for the spleen channel. So let's look at that. I'm going to put this off to the side. So I'm going to bring the shorts up a little bit so you can see the quadricep area. So I have that vastus lateralis on the outside. It's going to meet that junction where the rectus femoris takes off. And underneath that will be the vastus intermedius. That's going to be pretty much at the corner edge of the patella. So I can work up that little seam for the stomach channel, feeling that space, noticing that sort of valley that's formed by those junctions of the three muscles. Same thing on the medial side. Vastus medialis creates a little bit of a mountain and then falls into a valley where that rectus femoris ends on the medial side and deep to that blending in with the vastus intermedius. So I can work up that seam following up the spleen channel. So let's do a little work there. This will help teach the channels, but it'll also give a little functional focus to the channels. So we're going to work along that stomach channel. And in Chinese physiology, it's said that the stomach qi descends. You take in food, you want that food to pass through the digestive system to move down. You don't want it to rebel upwards in the form of acid reflux, vomiting, hiccups, those types of things. We want a continuous downward movement of stomach qi. So we're going to move the fascia, move the channel. We're going to influence it downwards. We're going to drop the channel down to help influence that stomach qi to go down. But also we're going to find that border, find that sort of junction of those myofascial structures and just sort of get more in tune with what that channel feels like. So I'm going to take my elbow, sink straight into the tissue, bend the elbow, but really what I'm doing is scooping the tissue with my elbow, dropping in and down, and I'm just going to move that fascia along the seam down towards the knee, descending stomach qi. So again, I can sink straight into the tissue, scoop, move the tissue down. Some sensation there. Should feel somewhere between a little sore to good. You don't want it to be extremely painful, but some sensations created from this. All right, but for now, really, I'm just sort of finding those borders, falling off the rectus femoris, sinking in to that valley of the stomach channel, descending the fascia downwards. You could do this as a self-treatment. You could also do it with a patient. Obviously, they would be on a treatment table and you could do this. But for now, we're just sort of getting in touch with that valley. Descending the stomach chi down. Descend towards the patella. All right, so I'm just working on the channel. Medial side, I could use my elbow, but it's going to be a little trickier because I'm going to have to pull up. Whatever structure, whatever tool works, but I'm going to change to a knuckle. And again, I'm going to find that valley where the rectus femoris, vastus intermedius meet at a seam, pretty much level with the patella. I'm going to sink in, fall into that fascial space, scoop down and up, and I'm just going to lift that spleen channel up. The spleen chi ascends. It extracts nutrients and brings those nutrients really into the blood, mixes with the chi from the lungs, pumps through the heart, circulates through the body. So we want the spleen chi to rise and lift. So for some people, they might find that the stomach channel is more noticeable, rigid, tight, dense. Maybe they have acid reflux, or maybe they have some rebellious stomach chi signs. Others might find this tissue is a little atrophied or soft or weak on the spleen channel side. Maybe the loose stools, bloating, various signs and symptoms that we would see related to spleen chi deficiency. So I want to almost tonify, lift, ascend the spleen channel, descend the stomach channel. But again, I'm just feeling for that fascial space, getting in touch with the channel. There's points along that channel, but I'm just getting in touch with the trajectory of it. So ascend, lift, pull. Stay on that boundary, drop in, scoop up, ascend, and I'm just heading towards the hip, towards the ASIS. So biomechanically, we can also look at the tracking of the patella. It's frequently the case that that stomach channel side, lateral quadriceps side, is excessively pulling on the lateral fascia of the patella, the retinacular tissue, pulling the patella maybe lateral, but pinning it down on the lateral side, almost like a clock. It's turned and pulled up towards that outer corner. So if we descend the channel, we can help reroute, move the patella, derotate the patella. And or the spleen channel is failing to sort of support it on the medial side. So it's not overcoming that pull from the stomach channel. So picture up on this lateral side, down on the medial side, patella is rotated in between. We want to move in the opposite direction. So same thing, same technique, but we're just thinking of a different focus. I want to sink down into that valley of the stomach channel, scoop the fascia, and influence it downwards. De-rotating, pushing that tissue of the patella down and de-rotating. So I can even follow through all the way towards the kneecap. And like I said, same thing on the other side, I can lift the spleen chi, lift the spleen channel, pull and influence the patella upwards on that medial corner. I'm not going to go too far on this side. I'm working on the knee, patellar region. I pretty much just travel through spleen 10, short, about a hand width up from the patella, short distance up. But I'm lifting one side, dropping the other side, de-rotating the patella. So looking at the channel down into the leg, we could continue on with the stomach channel on the anterolateral side of the leg. It's going to travel around the patella to meet at a point right in this area to the lateral side of the patellar ligament, which is that continual fascial structure of the quadriceps that now we call it a ligament because it's going from patella to tibial tuberosity, but it's just a continuation of the quadricep muscles. More of a tendon than a ligament, but technically bone to bone would be a ligament. I'm going to be right on the lateral side of that. Stomach channel descends from there. I'm going to drop into the tibialis anterior, one of the muscles of the anterior compartment, just off the bone, pretty much in the belly of the muscle. But as I continue down, I'm going to start to be more at the lateral border of that tibialis anterior muscle, between it and the extensor digitorum longus. As I get a little lower, tib anterior is angling medial. It's going to attach to the medial arch, spleen 4 region. So the low connecting point of the spleen channel. Interesting that a stomach channel muscle then crosses and connects to that low connecting point region. But we're going to follow down the stomach channel as that tibialis anterior goes medial. We're going to follow another structure, and that would be the extensor hallucis longus, which is kind of sandwiched between tib anterior, extensor digitorum longus. In that valley between those muscles, there's going to be another muscle that starts about halfway down the leg, and it's deep, kind of like deep in that triangle. And that's going to be extensor hallucis longus going to the big toe. So as we go a little more distal, we're following then that extensor hallucis longus. We get to the ankle. And if I notice the tib anterior tendon that's going to the medial arch, I'm lateral to that, but I'm also lateral to the extensor hallucis longus. So if I get into this little valley and I put my finger on my toe and resist flexion as I push down or push up against my finger, I'm extending the big toe. I should be able to feel that big toe tendon fire on the medial side of where my pressure is. If I feel it on the lateral side, that means I'm between tib anterior and extensor hallucis. I'm in the wrong area. Stomach channel is going to follow on that lateral side of extensor hallucis longus between it and extensor digitorum longus, the extensors of the 4 toes. I can follow that down then from there into the top of the foot, into the dorsum of the foot, following between the 2nd and the 3rd metatarsals space, then down to the toe. That will end at the stomach channel. Spleen channel is going to be on the inside, medial portion of the big toe. It's going to follow the medial arch into the flexor hallucis brevis, a really short big toe flexor. So I'm going to follow there. Then I'm going to come up and I'm going to be just on top of the tibialis posterior. Tibialis posterior is one of the muscles of the deep posterior compartment. And it kind of comes forward at about spleen 6. It's the first structure to pass just behind the malleolus. Spleen 5 would be sort of at a divot at the lower border of the malleolus. And the floor of spleen 5 would be tibialis posterior. Tibialis posterior then dives into the foot to support the arch, and really much of the foot. So spleen 5 follows it. Spleen 6 follows it. It's going to be at tibialis posterior. Tib posterior then goes a little deeper, and it's the medial or the middle muscle of the deep posterior compartment. So we're not going to be as directly in contact with it as we travel up, but we're still traveling towards, pushing towards that deep posterior compartment just behind the tibia, still influencing the tibialis posterior. But I'm following that up. Once I get to the knee, my final region for the spleen channel in that area would be where the pezanserine tendon, the sartorius, a muscle associated with the spleen channel, gracilis on the inside, semitendinosus on the medial hamstring group, where those form a common tendon that then attaches right at a point on the spleen channel called spleen 9. So it would be at that pezanserine, that common tendon of those three muscles. Then follow up into the spleen channel that we saw on the thigh. So back to the stomach channel, same thing applies, as I can drop into that tissue, hook and spread the fascia down, descending stomach channel. I'll be pretty much at that lateral border of it and that fascial space between it and the extensor digitorum longus. As I get a little lower, I'll start picking up the deeper extensor hallucis longus. And I can just take that down towards the ankle, descending that fascia, moving it down. And if I wanted to ascend, I can lift the spleen channel close to the bone, sink in, and lift. Maybe I could take my foot into a supinated position to help lift that spleen chi. Uplift tib anterior, engage it, and help it contract by pulling the medial arch. Kind of an odd position to work on yourself. This one's a little easier to work on with a patient or have somebody work on with you. But like I said, main focus is on exploring the channels, getting comfortable with where they are, and the idea of the movement of the chi of the channels, of that descending aspect of the stomach channel, ascending aspect and supporting aspect of the spleen channel.